Good day, everyone, and welcome to today's Decision on Asylum. At this time, all participants are in a listen-only mode. Later, you'll have the opportunity to ask questions during the question and answer session. You may register to ask a question at any time by pressing star 1 on your touch-tone phone. Please note this call may be recorded. It is now my pleasure to turn today's program over to Executive Director of Immigration, Sergio Gonzalez. Please go ahead.
Great. Thanks so much. Thanks, everybody, for joining today. Yesterday, over 80 national organizations sent a letter to the White House urging the administration to end the policy known as Title 42. As of this week, the policy has now been in effect for 2 years and has resulted in over 1.7 million expulsions at the southern border. It denies families and individuals the right to apply for asylum, disproportionately impacting Haitian and Black migrants fleeing dangerous conditions. A report released by Human Rights First recorded nearly 10,000 kidnappings, assaults, rapes, and other attacks against migrants stranded in Mexico because of the Title 42 U.S. border policy. Leading public health experts who have disclosed that there is no public health rationale for shutting down the border to asylum seekers. Title 42 has been weaponized to unreasonably deny Black and brown migrants the right to claim asylum. As Senate Majority Leader Chuck Schumer recently stated, Title 42 goes against everything that this country stands for. As we near the regular review of Title 42 by the CDC, which will occur next week on April 1st, this issue could not be more urgent. There have also been 2 dueling court rulings in the last few weeks on Title 42. The D.C. Circuit Court ruled that under U.S. law, DHS cannot expel or return people to countries where they are likely to suffer torture or persecution using Title 42. The decision will become final in about mid-April unless the Biden administration appeals it to the Supreme Court. In another case, a federal Trump-appointed judge in Texas overruled the CDC and ordered the Biden administration to expel unaccompanied children. Last Friday, March 12th, the Biden administration responded by ending Title 42 as it pertains to unaccompanied minors. The Biden administration has the capacity and the resources to manage migration and ensure an orderly process. While human smugglers and traffickers will misinform and take advantage of any change in policy, the administration is already working with neighboring countries to go after these networks. They have the administration's new asylum regulation lays out a plan to tackle the backlog, create processing centers, and increase review of cases, among other components, to meet the needs at the border. There is no question they need to continue to inform us and the public of these developments. We need to end Title 42 now. It is in the country's best interest, and it is the best interest of our nation's values. I'm now excited to introduce our next speaker. She's the amazing Congresswoman representing Massachusetts 7th District, who has been a tireless advocate on behalf of immigrants. She is the co-chair of the House Haiti Caucus, and in this role has fought against the disparate treatment of Black migrants and championed humane and just treatment of asylum seekers. Congresswoman Ayanna Pressley, thank you for joining us. I'm going to turn it over to you.
Good morning. Thank you, Sergio. Thank you to the Immigration Hub and our fellow immigrant justice partners for bringing us all together. And as good as it is always to be in solidarity and in community with you, virtually and otherwise, I come to this call this morning with a heavy heart, and that we have marked a 2-year milestone of this racist and xenophobic Trump-era Title 42 policy continuing to be in effect. In this time, this weaponized policy has resulted in more than 1.7 million unjust and inhumane deportations. Now, let me be clear. Title 42 has never been rooted in the science, nor has it ever been about protecting the public health. Public health experts, including one joining us on this very call today, have debunked this time and time again. No, this policy has nothing to do with public health. It has always been about stoking anti-immigrant fear and hate and undermining our humanitarian obligations to asylum seekers in this country. Title 42 flies in the face of everything that we should stand for as a nation. The hurt and harm posed by this policy is egregious, and it has a disparate impact on Black, brown, and indigenous asylum seekers. You remember the harrowing images captured in Del Rio, Texas, just a mere 6 months ago, as Border Patrol agents on horseback literally used leather reins, whips, on Haitian migrants hoping for the chance to seek asylum here in the United States. Many of these people carried nothing more on them than food and water. Now, while these images may no longer dominate the primetime news cycle, the trauma, the pain, and destabilization of families that has resulted from the Title 42 policy rages on. And we must stand up and call out white supremacy and anti-blackness in all of its forms. Here, domestically, we seek to do the work of dismantling white supremacy and to affirm that Black lives matter. Well, if that is to ever truly be true, if it is to ever really be true, and our destinies are tied, then Black lives must matter around the globe. As the representative of the Massachusetts 7th Congressional District, I'm proud that it is home to the third largest Haitian diaspora community in the nation. This is an issue that hits close to home for me and my constituents. It's why I'm also proud to be a co-founder of the House Haiti Caucus. And co-chair, and despite the ongoing humanitarian crisis, the security concerns and social unrest in Haiti, the Biden administration has expelled more than 20,000 Haitians in more than 200 deportation flights as of this week, with the majority expelled under Title 42. The lack of compassion speaks volumes and strikes a stark contrast to our more recent response to the humanitarian crisis unfolding in Ukraine. In a matter of days, the Biden administration has rightfully extended TPS protection, halted deportation flights, and have encouraged CBP officers to use their discretion to spare Ukrainian asylum seekers from Title 42. And that was the right decision. This is just another example of the arbitrary nature of this policy. All asylum seekers deserve this type of swift, compassionate response, humane response. Earlier this month, Representative Mondaire Jones and I urged DHS Secretary Mayorkas and CDC Director Walensky to fully end Title 42 and cease these unjust deportations. We cannot stand by and watch as Black and brown migrants, those from Haiti, from Cameroon, from Ethiopia, as well as many Latin American countries, continue to be disproportionately harmed and expelled back to harrowing conditions in their home countries. It is long past time for President Biden to end the Trump-era Title 42 policy. We have seen the administration bypass this cool and unnecessary policy for Ukrainian refugees seeking asylum. We need an equitable outrage here and an equitably humane response for all refugees. It's long past time to lead with compassion, to center the dignity and the humanity of all migrants fleeing for their lives, and to uphold his promise to restore the asylum system in this country once and for all. Thank you.
Thank you so much for your powerful words, Congresswoman. I will now turn it to Congressman Joaquin Castro, who represents San Antonio, Texas. He's been one of the leading voices calling for the termination of Title 42 since it was first put in place, and boldly led the charge in the House to shine a light on and demand an end to the most harmful anti-immigrant policies of the last administration. Congressman Castro, thank you for your leadership and for being here today.
Thank you. Good morning. Thank you so much, Sergio and the Immigration Hub, for convening us today. And it's always an honor to be with my colleague, Ayanna Pressley, on this issue and so many others. And she's absolutely right. There is no public health justification for Title 42, and at this point, it's being applied arbitrarily. In 2019, well before the pandemic began, Stephen Miller, the chief architect of the Trump administration's war on immigrants, pushed to use Title 42 as a way to summarily expel migrants from the United States. When Miller argued that Title 42 could be invoked because of outbreaks of the flu and mumps, the administration couldn't find the legal grounds to move forward. But when the pandemic hit, Miller tried again, and the Trump administration jumped at the chance to use this tragedy and this virus to their advantage. At the time, public health and medical experts forcefully pushed back. And COVID-19, of course, has been a devastating virus, but migrants don't carry disease any more than the rest of us do. And the Trump administration was able to invoke Title 42 by taking advantage of public fear about the pandemic and playing on racist tropes about third world countries. And as Congresswoman Pressley mentioned, the exemption for Ukrainians, allowing Ukrainians to have their asylum claims processed here is the right thing to do, but that should be the case now for everyone. And so the Biden administration must end the use of Title 42. And I also want to point out that, and Ayanna mentioned the fact that there continue to be Haitians, for example, that are being summarily expelled. And we can't be a nation where our compassion for refugees depends on the color of their skin. And so Title 42 must end for everyone. As the Biden administration, unfortunately, has dragged their feet on ending Title 42, Human Rights has documented nearly 10,000 kidnappings, torture, rape, and other violent attacks on people blocked or expelled to Mexico under Title 42. Asylum seekers should be able to request asylum upon arrival, even if they arrive without any prior communication with our government. That's consistent with our law and consistent with international law. But because of Title 42, thousands of Haitian and Central American families, including children, have been forced to rely on dangerous smugglers or attempt often deadly journeys across the border themselves. This should need to be said, but people don't trek thousands of miles through dangerous conditions for fun. And they're not doing this on a lark. Asylum seekers come because they're facing life or death situations, and they believe that America will fulfill our promise to welcome the huddled masses yearning to breathe free. And as a free nation, and as the most powerful and wealthiest nation on earth, we should extend them a welcoming hand. And President Biden inherited an asylum system that was left in tatters by the Trump administration. But it has been the choice of this administration to extend Title 42 over and over again, and it must finally come to an end. Over the past year, we've chipped away at Title 42 with exemptions for Ukrainians, unaccompanied children, and those facing persecution or torture. So if we can end parts of Title 42, we can end the whole thing. I support the Biden administration's work with Congress to address the root causes of migration, including violence, poverty, and corruption. And in 2017, Trump ended the Central American Minors Program, which allowed children with parents in the United States to apply for asylum from their home countries. His administration also blocked hundreds of millions of dollars in assistance to Northern Triangle countries. And there's no doubt that the situation at the border right now is in part due to the Trump administration's destructive policies. But it's up to the Biden administration at this point that has carried those policies over for quite some time now to finally end them. And I hope that they will take that opportunity by next week. With that, I turn it back over to Sergio.
Thank you so much, Congressman. I hope they do too. Our next speaker is Dr. Adam Richards. He's a member of the Physicians for Human Rights Board of Directors and the Associate Professor of Global Health and Medicine at George Washington University. Dr. Richards?
Thanks, Sergio, and to your team at the Immigration Hub for the invitation to contribute the perspective of public health science on today's call. And thank you to Congresspersons Pressley and Castro for your consistent support for the rights of asylum seekers and your powerful remarks today. There's no public health justification for Title 42. The message is simple, and it's the same message that we public health professionals have been repeating for 2 years, but it bears repeating because the administration has yet to align its policy with the scientific fact that there's no public health justification for Title 42. I'm a physician, public health teacher, researcher, practitioner, and I take COVID-19 very seriously. So last year I lived in Los Angeles and worked in a COVID isolation quarantine center when LA was at the epicenter of transmission and death, and I lost patients and colleagues who are no longer with us. But even when it doesn't kill you, COVID takes a toll on our bodies and on our communities. So now that I live in DC, I work in the COVID recovery clinic, caring for patients with long COVID who suffer the physical and emotional consequences of COVID. They're exhausted, but they can't sleep. They have chronic headaches, shortness of breath, difficulty concentrating, and this affects their ability to work, to care for their families. Like you, I take COVID seriously, and I want us as a country to do what we can to reduce our risk of infection, death, and disability. But Title 42 does not protect us from COVID. There is no public health justification for Title 42. But don't take it from me. You can listen to my neighbor. Turns out Anthony Fauci lives a few blocks away. Fauci agrees there's no public health justification for Title 42. He's received many death threats, and he chooses his words carefully. As Fauci put it, COVID-19 transmission, quote, is not driven by immigrants. And he continued, quote, expelling migrants is not the solution to an outbreak. Not everybody likes Fauci, so how about listening to our professional colleagues from other leading institutions of public health and human rights? So we've sent a series of letters to both the Trump and Biden administrations and have repeatedly explained how Title 42 does not protect the public health. We've offered common sense, evidence-based, rights-respecting recommendations for the safe processing of people who arrive at the U.S.-Mexico border. A powerful perspective piece published 2 days ago in the leading medical journal, New England Journal of Medicine, applied a similar scientific lens to Title 42. And you've likely seen these letters and read that journal piece, but if you haven't, I can summarize their categorical conclusion. There's no public health justification for Title 42. So procedures exist to safely process asylum seekers at the border, and the risk to the health of the public in the United States is close to non-existent. However, the threats to the health of asylum seekers who are prevented by Title 42 from crossing the border are very real. I heard these accounts firsthand in Tijuana from asylum seekers who looked me in the eye and courageously described how they were extorted for money and exposed to physical and sexual violence. They shared how conditions on the border were taking a toll on their mental health. If you'd like more detailed stories from the border, I refer you to the report from last July by a team of PHR researchers who visited Tijuana and Ciudad Juarez to document the health and human rights consequences of Title 42. I found that every aspect of the expulsion process, such as holding people in crowded conditions for days without testing and then transporting them in crowded vehicles, increases the risk of spreading and being exposed to COVID-19. But if you aren't moved by stories and reports and prefer quantitative studies with numbers, Human Rights First has tracked more than 9,866 reports of kidnappings and other violent attacks against migrants on the border since Biden took office. So that's nearly 10,000 violent attacks that could have been prevented by ending Title 42. There is no public health justification for Title 42. Thanks.
Thank you, Dr. Richards. Our next speaker is Wendy Cervantes. She's the Director for Immigration and Immigrant Families at the Center for Law and Social Policy. Wendy?
Thank you, Sergio. It's a pleasure to be with you all today. CLASP is a national anti-poverty organization based in D.C. that conducts research and advocacy to advance the well-being of children and families with low incomes and communities of color, including policies that support healthy child development. CLASP also helps lead the Children Thrive Action Network, a national coalition of more than 100 national, state, and local children's advocacy organizations and providers, all committed to protecting and defending children and immigrant families. As a coalition, we have called on the Biden administration to put the best interests of children first when making policy decisions. And yet the administration has ignored that standard by continuing to implement Title 42. We commend their decision to not apply the policy to some children arriving to the U.S. alone, as well as to Ukrainians, but that is far from protecting all children. The consequences of Title 42 over the past 2 years on children have been devastating and shameful. And while the numbers of those hurt by the policy are astounding, it is important to recognize that putting even one child in harm's way because of a flawed, arbitrary, and ineffective policy is simply wrong. I am here today as an advocate and policy expert, but as a mother to 2 young children and a citizen, it breaks my heart to imagine that any family or child in need could be callously turned away by our country or sent right back to the danger they were seeking to escape. For any woman who has given birth, imagine being forced to do that in a tent in a strange country without any medical assistance. For any mother or father who knows the strong desire to protect your child from harm, imagine having to flee your country and travel hundreds of miles over oceans and borders in the face of harsh weather and other dangers to seek safety for your child, only to have the door slammed in your face. For anyone who has ever loved a child, imagine being forced to make the decision to send that beloved child or toddler or baby across a foreign border without you, alone or in the arms of a stranger, because that may be your only hope to get them urgent medical attention or to a safer place. Imagine that child clinging to you and begging to stay by your side and knowing you have no power to protect them. Imagine the pain and the desperation. And yet, this unimaginable cruelty is exactly what our government has been inflicting needlessly upon parents and children every day for the past 2 years. It's time to end the suffering and to welcome children and families with dignity and compassion. We call on the Biden administration to rise to the challenge, honor our American values, and stand by its own commitment to prioritize the safety and well-being of all children and families by ending the Title 42 policy now. Thank you.
Thank you so much, Wendy. And our final speaker is Gladys Molina. She's the Executive Director with the Young Center for Immigrant Children's Rights. Gladys? Hello? Gladys, are you on? She might have been disconnected. Gladys, I'm just gonna. I think we'll turn it over to Q&A, and if she joins, we can take remarks.
Sergio, I'm back on. I got kicked off.
Oh, okay.
This is Gladys. Yep.
Okay. Hi.
Good morning.
Great. Do you wanna go ahead?
Sure. Thank you. Good morning, everyone. I represent the Young Center this morning as its Executive Director. The Young Center is a national nonprofit organization that works with immigrant children in government custody. Our main mission is to advocate for the best interest of immigrant children. In the last 2 years since the implementation of Title 42, we have known two things to be true. One, our government is effectively separating more families, perhaps more than those ripped apart under zero tolerance in 2018. Number two, children have been returned with their families to dangerous conditions in Mexico or be forced to return to conditions they were fleeing in their home countries without the opportunity to apply for asylum in the United States. In early November 2021, when the border was reopening in South Texas and along California and Arizona to tourists and border crossers with visas between Mexico and the U.S., I attended the camp in Reynosa, Mexico. Through our collaboration with the Sidewalk School, which is based in Brownsville, Texas, I was able to see firsthand the process of Title 42 expulsions from South Texas to Reynosa and to meet with people at the migrant camp in Reynosa. During a brief presentation and question and answer session that I conducted with migrants there, I heard many parents who were concerned for their children being sexually assaulted or kidnapped. I spoke to a mother who told me how she stayed up every night to watch over her teenage daughter and would get to sleep during the day if she had a chance. Being exposed out in an open camp and with fears of being dragged out at night, Reynosa is simply a terrifying place for Central American, Haitian, and asylum seekers from other places in the world. There is no recourse for justice for migrants in Mexico, and there is simply a sense of U.S. asylum law being suspended with no accountability for the government by the people who are impacted by the suspension of our asylum law. Time and time again, as I stood there in the middle of the migrants in the camp, people asked when Title 42 would end, and they asked when they can be reunified with their children who had crossed the border alone. Family unity is not a human right that should depend on where you were born. Children are children, and they belong with their families. The Young Center has worked with dozens of children who were forced to seek protection alone at our borders while their parents had to be in Mexico. Title 42 continues this horrifying practice of family separation at the very time that the administration is working on the Family Reunification Task Force and trying to remedy families who were separated by the prior administration. Yet despite a change in leadership, our immigration policies continue to fail children and violate international and our domestic asylum law. Title 42 must end now. So, Mr. President, tear down this asylum wall. Thank you.
Thank you so much, Gladys. Okay, we can go ahead and open up for some questions now. And just for the media, Congresswoman Pressley and Congressman Castro had to jump off. They have other engagements. So, operator, if we want to go ahead and take any questions that anyone might have, we can do that now.
That's perfect. At this time, if you would like to ask a question, please press star 1 on your touch-tone phone. You may remove yourself from the queue by pressing the pound key. Once again, star 1 to ask a question. We will pause a moment to allow questions to queue. Once again, that's star 1 to ask a question.
If there are no questions, we can go ahead and close it out. And I just want to offer any of our speakers today to offer any closing thoughts if they would like to.
And at this time, there are no questions.
Okay, great. Any closing thoughts from our speakers today?
Are you just expressing gratitude to Immigration Hub for bringing us all together, and Congresswoman Pressley and Congressman from Texas?
Thank you so much, and thank you for joining, everyone. Obviously, the message is loud and clear today. Children's advocates, members of Congress, immigration advocates, civil rights advocates, faith leaders. There's a wide and growing coalition of people who are calling for the end to this, as Congresswoman Pressley called it, xenophobic and racist policy. I truly believe that this administration is better than this policy, and it's time for this policy to end now. Thank you for joining today's call, and we look forward to working with you in the future.
Thank you.
Thank you.